Bell palsy. Bell's palsy is an idiopathic or a good amount of time and a little one less amount and a small amount of time it is due to infection, viral infections of the upper respiratory tract, your influenza viruses and other viruses like your herpes virus, cytomegalovirus, and so forth. Yeah, maybe concomitant bacterial infections also there. What this infection does, the infection causes the your stallomastid foramen and edema, and thereby compresses the facial nerve and disconnects it's from its supply part. Thereby, you have your Bell's palsy, facial nerve palsy of lower motor neuron variety, and they have at times due to the infiltration as an etiology at times good amount of time little less amount of time you have little bit of your uncommon diseases compressing upon the your facial nerve in the sternostart foramen, and usually it is unilateral. The child have paralysis unable to move the your one side, both upper and lower part, and along with it the child failure to blink or raise the upper eyelid and failure to close the eye, feel difficult deglutition problem, swallowing problem, and your angle of the mouth is little bit of debated. Which way is debated? Healthy muscle, they pull the angle to their sides, and so thereby the disease part is difficult, and then the so child is a little bit deformed and is a little bit discomfortable sort of presentation. There can be a little bit of pain and investigation. Most of the time you do not need to investigate and only treat the cause of viral infection if it is secondary bacterial infection, and stallomastid edema can be reduced by prednisolone 2 milligram per kg for 5 to 7 days, then taper one by another 1 week or so. If early cases, they have very good outcome. Late cases, maybe a little bit 10% cases can have residual, the paralysis, but they do recover in long term also, months, years also may be needed, and the your eye close are defective, so there is possibility of exposure keratitis. These children need your methyl cellulose drop or an ocular lubricants to prevent the exposure keratitis. And consultation, physiotherapy, refer to physiotherapy center is good for the early recovery of the muscle dysfunction.